And there is a difference between reflux and reflux disease. And I think that's confusing for people. So I just want to like tease that apart. So reflux in the medical world, that can just mean a happy spitter. Okay, they have reflux. There's refluxing. The contents of their stomach are coming up and they're happy and they're fine. Reflux disease, because now in medicine we have to put the word disease on everything, which sounds terrible. But that means something more is going on, like your baby's having pain, they're uncomfortable, they're not happy, they're irritable, they're not feeding well. So I just want to tease that out in case you hear those two terms and you find it a little bit confusing. Also, there can be overlap with allergies and colic and things like that. So you do want to just make sure you talk to your pediatrician about it because the diagnosis can sometimes be a little bit tricky. I just want to emphasize in the case that your baby does not have any of these red flags, like in the case of the happy spitter, that they are able to gain weight and be happy and just spit up and that's the end of it, really no tests are needed. And this is what in medicine we call like the quote unquote clinical diagnosis. And that is based on symptoms. So you come in, we look at your baby, we're like, yes, your baby is looking really healthy, no concerns there. We've listened to their heart and their lungs and their tummy, and we've weighed them and checked all of the things that we need to check. And we're like, yes, they seem healthy. You haven't told me anything that makes me worried. Then I will most likely say your baby is a happy spitter. Go home. Let me know if something changes, and then we'll look further. And that is what's called a clinical diagnosis.